Dr. Jaspreet Singh, urologist in Newburgh, New York, talking to you guys about a minimally invasive way to take care of prostate enlargement. 73-year-old male came to see me in the office, unable to urinate. He has had a Foley catheter in for over a month now. He has failed medications, miserable with the catheter, looking for other options. Now he has other medical issues that prohibit him from any sort of invasive procedure in the operating room. As we're getting started here, we're in the urethra, the channel that runs through the prostate. The UroLift procedure, a unique way in compressing the prostate and opening a channel up. Here we're getting ready to fire our first implant or suture. There is compression that is caused by pushing the prostate to the side. I tell my patients this is like opening curtains on a Broadway play, drawstring to keep the curtains open. This is what we're doing to this enlarged prostate that unfortunately is making it difficult for this patient to urinate. In just that easy, simple fashion, we've placed our first stitch in place. We're working on the other side. This would be patient's right side. As you see here on the right side, the prostate is overhanging, pushing into his urethra. I'm using the UroLift device to push the prostate to the side, and I'm getting ready to fire the other stitch, making sure that the deployment is accurate, the appropriate tension is being placed, and we're getting ready to cut the excess suture. And this is done by seeing that white tab, and there we are. I'm advancing the scope back into the bladder. I'm going to take a quick look to see if there's any other position, any other place we can open this channel up. As you can see already, the channel is starting to open up. Look at that prostate being swept to the side. I see a little bit of an overhang of tissue here on the left side. We'll take care of this easily. It's a fine line between putting these stitches too close to the bladder. Surgeon expertise and obviously comfort with this procedure is necessary. Here we are just far away from the bladder. We want to make sure we don't leave any stitch within the bladder, as this can cause issues down the road. Any foreign material inside the bladder can cause stones, irritation, which we are avoiding. There's no need to cut the prostate, no need to heat the prostate. This unique intervention just sweeps the prostate out of the way, making it much easier for our patients to urinate almost immediately. Some of the other advantages here for the UroLift procedure is no risk of any ejaculation disturbance. A lot of my patients complain that they're unable to ejaculate with Flomax or Rapaflow, and these medications are known to cause that side effect. We're looking at placing our final suture on the right side, and I'll make it so that this bladder neck, this opening of the bladder, to be nice and open. This guy's going to have no problems urinating. He's been miserable for over a month with this catheter, which we should be able to remove. In fact, at the end of this procedure, I left this patient without a catheter. He was able to urinate as soon as he was awoken from the anesthesia. Most of these procedures done with a little bit of anesthesia, outpatient setting, often in the office or at the ambulatory center. Quick recovery. Most patients physically need about 48 hours to recover. As you can see here, channels wide open, push the prostate to the side. This patient is going to be extremely happy. Dr. Jaspreet Singh, Newburgh, New York, urologist, bringing you innovative BPH treatment.